Lecanemab, or Leqembi, is a new medication that's been approved for the treatment of Alzheimer's disease. It's an IV infusion, and it works by targeting amyloid in the brain so that your immune system can recognize it and clear it out of the brain. There's been several medications like it to come before it. All have proven to be very good at removing the amyloid. Not all of that success has translated over to clinical benefits. Thankfully, the lecanemab did show definite clinical benefits when they did their controlled trial. Unfortunately, it was not shown to be a cure. Patients receiving the medication did continue to progress in their disease, but it did slow the progression of that cognitive decline by up to 30%. There were major side effects seen in the trials with this medication, as well as all other medications that work in a similar way. In the act of removing the amyloid, the immune system does, in some cases, create some collateral damage within the brain. And this is what creates the major side effect of this drug class known as ARIA, or amyloid-related imaging abnormalities. This can come in two types. The first is basically inflammation of the brain caused by all of that immune activity. The second is a hemorrhagic type, meaning some bleeding onto the brain because the blood vessels can become damaged and start to leak. In both instances, they were typically discovered incidentally because they were doing regular MRIs on all of the patients. And most of the patients who had these side effects were asymptomatic, and many were able to stay on the drug. But a small percentage of patients did have more severe reactions, and some of them possibly even left with permanent deficits, and in those more severe cases, they did have to stop the medication. This medication is very expensive. If purchased out of pocket, this would be tens of thousands of dollars per year. Medicare has released statements indicating that they will cover it, but it is hard to predict what the out-of-pocket costs might be, not only for the medication, but for all of the other testing that's required. Not every patient is even going to be a candidate for this medication. Because of the risk of that bleeding type of ARIA, any patient who is required to be on a blood thinner would not be a candidate for the lecanemab. Additionally, any patient who is unable to get an MRI can't go on this medication because it is so important that we're able to do regular MRIs to monitor for these side effects. One other very important factor to consider with this medication is that all drugs in this class, when they were first studied on big groups of people with dementia, they actually failed those trials pretty significantly. The reason being, what they came to find is that these drugs only seem to work if started on the very early stages. So in order to qualify for this drug, a patient has to be either in the mild cognitive impairment stage or very early mild dementia. Patients with more advanced Alzheimer's, unfortunately, would not be a candidate because it was shown that the drug did not work for them. There's a major commitment that this drug does require. Not only financially, because the drug is expensive, but a big time commitment as well. The drug's infused once every 2 weeks. So twice a month, this would require that the patient go to an infusion center, and then for at least a few hours, they would be there to receive the medication. In addition, you would need to factor in all of the time for all of the testing before the drug's even initiated, as well as all of the monitoring MRIs that come after the fact, and that would be at minimum 4 total MRIs in the first year alone. If after considering all of those factors, the patient decides that this is a medication they want to pursue, and if their doctor agrees that they are appropriate for the medication, then the next step would involve some baseline testing. There is some blood work that would need to be obtained that can help with stratifying the risk for ARIA. And then, of course, the most important test that we would need to get is to prove that amyloid is even present. This can be done either by a PET scan or by a spinal tap with assessment of the spinal fluid.